All right, so I have 5:32. So we'll call to order the REMAC meeting. We'll start with the pledge. And then we can do the silent communication.
Thoughts that we have enough data.
Okay, do a roll call attendance.
Yeah.
We're gonna do a roll call attendance just to make sure we've got enough dots for a quorum. So Dr. Coates, come here. He's here. Dr. Holliday.
Present.
And that gives us a quorum. So we'll stand for the pledge.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, stay standing for a moment of silence for the Air Methods crew that was lost. Okay. So for those of you who don't know, there's been some changes here at the program agency. I am obviously not Ann. Ann has moved on to a position with the Department of Health. So effective the start of last month, I took over as program agency director. I'm Jonathan Cole. I've worked with all of you. I'm very excited to work with you in this new capacity. Jess Thompson, who is in Governor, she is our clinical coordinator. She'll be spearheading a lot of our educational things that we're gonna be doing out of the office, our Stop the Bleed program, Narcan trainings, things like that. And then sitting next to me is Amanda Slate, who is taking over my position with the program agency. She comes to us from Carthage Rescue with a long experience in EMS, and she'll be a very good asset for the team. And we still also have Zach over in the Mountain Lakes region. So approval of the October minutes. Minutes were sent out with a meeting notification. If there's no changes, we entertain a motion to accept those as written.
The date at the top should be 22, right?
Other than fixing the date,
Maybe the motion. Each one.
Accept the minutes.
Oh, sure.
okay, motion by Chris Singleton to accept the minutes with that change. Second. Oh, Dr. Coates seconds. All in favor?
Aye.
All right. Correspondence. You share the DOH enforcement list. Go ahead, Deb.
So this is the enforcements, and what I've done is I've added information rather than just stating what the violation was. I'm giving you what the actual violation is so that you can see those. So the first one from Jamaica, this appropriated money or property from any service during the course of any EMS duty or practice. They surrendered their license or certification. The next one surrendered plus had a civil penalty of $500 for physical abuse of a patient. The next one had a suspension and will not renew when their certification expires, failed to comply with the requirements, has been negligent in their performance of EMS duties, and has been incompetent in the performance of their duties. The next one was a criminal offense. Their license or their certification was revoked. The next one is a fire department, and they got cited for a lot of things. They ended up getting their suspension stayed. They've got a 3-year probation and have to do a civil penalty. And this is what we need to make sure our departments are covering all this. So medical directors, when you're talking with the agencies that you oversee, we need to make sure they're doing this. So had not been competent, had not been competent in the operation of the service, shown inability to provide adequate ambulance service, has failed to file any report required by the provisions, had discontinued operations for a period in the excess of 1 month. Their CON was outdated by 2 years. Minimum inventory equipment, they didn't display an out of service sticker on an ambulance. Maintain an ambulance which conforms to the standards. They didn't have a minimum requirement. Didn't maintain, again, their current state issued cert. Maintain the interior of the vehicle and equipment in a clean and sanitary condition. All equipment clean and sanitary, and O2 tanks were out of hydrostatic testing. The next person's from Rochester. They surrendered because they responded to a call while under the influence. And the last one got a 3-year probation and a civil penalty of $2,000, failed to comply with requirements, required conduct. They were negligent in their performance. They were incompetent and falsified a patient record.
I do not have any other correspondence. So we'll move on to reports, air medical reports. Colleen was gonna send out the LifeNet reports, but I did not get them yet. Matt, do you have anything that you can?
Nothing from REMAC.
Tuttle, anything?
I don't believe so. Nothing I'm aware of.
Okay. State EMS meetings were held December 6th and 7th and February 7th and 8th. I'll let Mark Devers report on those.
Give me just a second. I forgot I had to give the report.
The next meetings are made.
Yeah, with air medical, there are 2 helicopters in Watertown currently with full crews. They anticipate at least 2 months, if not a little bit longer. They're waiting for their basement room to be finished, so there will be 2. There's 710 and 714, just so people are aware.
Yeah, I assume that Colleen put that in the report, but there are 2 helicopters operating out of the Watertown Airport and will until the Oneida County operation is up and running. I suspect it will probably be longer. 2 months.
Ready, Mark?
Almost.
Spring this meeting, we didn't know it was coming.
Sorry about the delay. They've been working pretty diligently on aligning the unified protocols from New York City with the collaborative protocols. And they're getting closer and closer to doing that all the time. They are hiring more people than they ever have to do more enforcement than they ever have, and not doing a lot of other things. Vital signs is October 17th. The Rural Health Task Force is up and running. They did issue policy statements on O2 tanks, and as Debbie mentioned, the number one thing they're citing for right now is hydrostatic testing. One of the big problems that a lot of places are finding is it's a very lengthy process to get the hydrostatic testing done. So please keep an eye on it, and the new policy statement does provide pretty clear pictures as to what the numbers mean. The iGel project has been approved, and you can reach out to Jonathan for information on how to do BLS iGel if you so desire. They're still having testing issues, but they claim it's less and less. They are working on finalizing TXA. The SEMSCO and Deputy Director DeJura met with FLIPIC, which is the Public Health Policy Committee. That's basically the SEMSCO of the hospitals, to discuss wall time. And it sounds like they are, it was a positive meeting, and they're going to, at this moment, a lot of what they're doing is discussing with the the docks that it is actually an impact. Everything that you are sending to the state is now on a form. And most of the stuff has changed. If you go to add a vehicle, you now have to send pictures of, I believe, one side of the vehicle and the registration and inspection sticker. And they're all on EMS forms on the state's website. Part S is in the budget that still hasn't been passed, and it was quite an extensive reform of Article 30 law. Some of the things that have not made it into the one house budgets are a complete change to the CON process. The other big thing is EMS districts. The CON process kind of got knocked out because it doesn't make any sense, and the districts got kind of knocked out pretty aggressively because nobody actually knows what their purpose is. There is a copy of the state's PowerPoint that tried to explain the Part S changes floating around. Feel free to email me if you'd like it. There is some other good stuff in the governor's budget, including a little over $13 million into EMS Medicaid. There's some, the definition of EMS, which would allow for community paramedicine and a few other things. Humongous push on safe transport of kids. They've done a fair amount. 10,756 EMS students took classes last year. There has not been an increase in the number of students taking classes on an annual basis, though, over the last 10 years. They've added PSI testing centers in Burlington and Erie, Pennsylvania. The new practical skills exam probably will never get put in place. They are looking at course sponsor reimbursement. EMS for children is a big thing, including safe transport for kids and psychological care of kids. There's a massive quality metrics project that will be coming out in the near future. It's actually a good thing to get as much data as we can. They're going to be using a state program called Biospatial, which supposedly will be able to organize all of this data. They are in the process of getting the state medical director program up and running. I would not look to see that anytime soon because New York State really moves not very fast. Focus on mental health. There's CON appeals out the wazoo. One of the ones that we had was actually a countywide CON that is granted under general municipal law, but the county sat on it for almost all of the 2 years before they converted it, and it became a little bit of an issue, and unfortunately the state completely dropped the ball and sat on it for like 4 years, and some interesting decisions were made. And there's more CON actions to come. And the Part 800 changes that were approved prior to COVID might almost make it to public comment before the May meeting. We're not real sure because they sat on Steve DeGiro's desk for like 3 years. So, end of report.
The white paper?
Oh, yeah. The white paper came out, the data-driven EMS agenda for the future for New York State. If you have not seen the 70-page document and would like to read it, I will be happy to send it to you. However, the highlights of it are done pretty well in the first 2 pages of the document. So it lays out 25 recommendations. Some of them are actually in the governor's budget. I believe 16 of them were in the governor's budget. I will open up the document real quick and give you the 25 recommendations. So the recommendations are a statewide EMS plan, increase the number of EMS providers, fund a recruitment campaign, engaging stakeholders, engage the hospitals, create a financial, logical, and rational EMS system, create a safety net system, establish EMS leadership credentialing, incentivize implementation of tiered response systems, develop agency performance standards. So like you have to respond to a certain percentage of requests, require dispatch centers to engage local authorities, coverage reliability and performance standards, fund county EMS coordinators, give Article 30 control over 911 centers so we can force best practices, EMS cost reporting system, define EMS as an essential service, develop a grant program so that agencies can apply for grant, create a grant program for the REMSCOs and allow each REMSCO to be able to take grant applications from agencies, allow for community paramedicine, take a look at what could be moved to the BLS level, increase course funding, put in a degree requirement for paramedics, certification to licensure, that's in the governor's budget. Require hospitals to have an outreach, EMS outreach coordinator to do day-to-day communication. Form a working group between the SEMSCO staff, EMSC, and others, and fund administrative support for the SEMSCO through the Bureau. So those are the 25 highlights of the 25 recommendations, and I will be more than happy to share this document with anyone if you'd like it.
Any questions for Mark? Okay, next meetings, state meetings are May 9th and 10th. So old business protocols, so the protocol update or app updates have been done. I don't know if they've pushed out to everyone or not yet. They are in the works, and then the next thing that we're working on, especially with the app, is gonna be, excuse me, is gonna be a lot of like grammatical things and just cleaning it up that way. Jess has been working on that. We are in the office working on the updating our med control handbook that we used to give to all the hospitals and making sure it's got updated policies in it, as well as the collaborative protocols, so that you have them there to reference. So that should make things a little easier. We're gonna try to have all of that done by the June meeting. Quality Corner Committee, Jess? Or Melissa? Or Mark? Data Committee, so Zach Boucher, who is from the Mountain Lake side of the program agency stuff, and I sit on the state's data quality committee, working towards the transition at the end of the year to NEMSIS V5, which should hopefully give us a little bit better data. Zach and I specifically are working on the education portion of it, and asking Peter Brody a lot of questions that he doesn't really want to give us answers to, mainly why. So that's where we stand with that. And we'll go into the program agency report. So Jess, I'll let you do RTAC.
Okay, so Ann and I attended the last RTAC meeting. We have upstate reporting that they were at 118% capacity. They're also pushing for their burn echo educational presentation. This is for CME or CEU credits. They're held from 12 to 1 p.m. The third, I think it's the third, whatever that day of the week would be, on those. So the next one is June 16th, and then we have the 22nd of September, and then December 11th. CPH did report that they're missing about 25% of their charts when it comes to trauma criteria. So please contact our office if you need any of those. And then the trauma centers are getting verified in this new year. This was reported out, and they're using new guidelines. One of the ones that the revisions that they're going over is the mental health is available for MHL for mental health is available. The next revision that they're going over is geriatric trauma and traumatic brain injury for best practices will be out by the end of the year. They also mentioned, I believe the last one was chest trauma, but this won't be out till at least the summer, if not in the start of next year. And then they're moving into, I think there's some of the criteria that they're changing into is going to the gray book instead of the orange book that they're converting over to at the hospitals. Actually, this one was canceled last minute. That's all I've got.
So Upstate Stroke Quality Group, we still have funding available for agencies. We just need to go in and take the test that's on the CME site and then fill out the roster of their participants. 50% of their providers have to take this that are primary to their agency, and we'll send them a check for like $230. So there's still tons of funding left. We're gonna meet with them. I think I have a meeting with them next week to decide what we're gonna do with the remainder of funding, because nobody's.
Year into it. How many?
We're 2 years into it.
Yeah, I was like, well, I mean, I was involved for a
Yeah.
year. Yeah. So how many agencies from the North Country have taken advantage of this?
Not a whole lot.
That's just.
BLS renewals, so these are the ones that have come through our office that we've gotten certificates for. And I did get a couple today that just didn't make the list. The iGel BLS demo project, these are the agencies that have submitted for it. It's all run through the Hudson Mohawk region, but they still have to get regional approval before they can do it. So South Jeff, Parishville, Tri-Town, Evans Mills, and Lewis County Search and Rescue. BLS adjuncts, we have applications from Seaway Valley for BLS Narcan, BLS albuterol, syringe. Epi is just a notification that they're doing it. BLS blood glucometry for Hubleton and Seaway Valley. Hubleton would be pending their Wadsworth, and we have Seaway's Wadsworth. BLS CPAP for Seaway Valley, and we have no BLS 12 lead applications. So I'd entertain a motion to approve them. They all have submitted their paperwork. Everything is correct. We're just waiting on the lab license from Hubleton.
Need a doc.
I need a doc to do that. Dr. Coates, he raised his hand. And I have a second.
I'll second.
Dr. Holliday or Dr. Delaney, either one, you both spoke at the same time. All in favor? Moving on. We'll get approval letters out to them. We do have a BLSFR application. This has to go to the REMSCO for an approval. Dr. Howland has agreed to be Helena Volunteer Fire Department's medical director. So that'll be handled at the REMSCO. EPCR, we have DeGrasse Clare South Russell, who still, we're waiting on a go live date. And North Pole goes live tomorrow, so I'll be here nice and early to make sure that transition goes kind of smoothly. Remaining, we still have them listed there. We do have a number of agencies that have reached out to us about going to electronic documentation, but none that have really followed through. Data integrity, so the schematron update that was supposed to be in January has now been moved to May. I think it might get pushed again, but the program agency is working with the state to develop the education. The goal is to move to NEMSIS 3.5 by January 2024. We did do a review of glucagon, which I'll cover later when we get to do business under drug shortages. And the NOR-EPI report should have been sent out to everybody for your review. Jess, do you have anything to add to the NOR-EPI report? Should have been with the. If you didn't get it, I'll send it to you first thing tomorrow. I thought we had sent it out. It could have gotten this. It's been a little turbulent here.
Hey, Jonathan,
Yeah,
go back real quick. The agencies that are supposed to be doing EPCR, those names have been up there for quite some time. If they're not going to do this when they go to renew, is that going to get denied?
no, it only matters if they're in the CME program for renewals.
Okay.
So if you're, as of right now, and I think this will change, I think the state is, they're setting up the groundwork to push towards making everybody be electronic. But if you're not enrolled in the CME renewal system right now, you do not have to be on electronic documentation.
So it's just for the in-house CME. It has nothing to do with people from those agencies wanting to become certified, to get the reimbursement, you have to be a member of a certified EMS agency.
Correct.
As of right now, that's not stopping that.
That's
process.
not stopping them at all. But the state has stopped printing paper PCRs, so it's gonna stop them at some point because they're not gonna be able to get paper PCR anymore.
Transporting agencies are required, correct?
Yes.
It's just, fire, non-transport,
Yeah,
fire
just
department
non-transport.
who don't do a CME program.
Yep.
Still can push paper.
But I foresee the state putting an end to that in the next year.
Well, that, all forward, you can be certified without an agency.
Yeah.
Before they get any leverage there.
So EPCR integrity, I will send out the NOR-EPI report if you didn't get it. Let me just write that down.
This is the one that was presented before. Maybe it was.
What's that?
This is the one that was presented before. I think it was presented at Mountain Lake.
Oh, okay. We'll send it out to everyone. Sorry about that. Continued issues with ESO. So we are making some headway with this. The state has made ESO come in and have sit-down conversations on Long Island at least, and now they're working on scheduling one more in the mid-state region to capture everybody else. There's more of a population of agencies that use ESO down by the city, so it just made sense for them to be the first ones to jump on them about it. But I have agencies that I'm missing probably 50% of their calls are not making it into the system. And it's no fault of the agency, it's no fault of the provider, it's the software vendor. We are pushing and leaning on the state a little bit to say that if you're not to ESO, if you're not gonna be compliant, you're done playing in New York State. But for some reason, we're getting pushback from the data and informatics team on that. I don't know why. Training, so we did the Surviving and Thriving with Words Count EMS Financial Management Training. That was March 14th and 15th. It was originally supposed to be hybrid with a location here in the office and virtually, but that's when that nor'easter hit and Maggie Adams, who lives in Philadelphia, Pennsylvania, could not get out of Philadelphia, Pennsylvania. So we did it completely virtual. We had 30 people attend it. Spring Fling is scheduled April 27th through the 29th. As of this morning, when I did the report, we had 101, and I think I got 3 or 4 more today after that. The leadership conference, so we are partnering again with the AHEX in the state to do the leadership conference. It will be a hybrid format at the Queensberry Hotel, Saturday, May 13th, and registration is scheduled to open this week. The theme around it this year is cultural changes in an ever-changing field. Really focusing on not so much recruitment, but retention and provider PTSD and mental health. Also with some compliance thrown in there too. The learning management system has launched. It launched at the end of January. Right now, we're at 278 providers, which is roughly 20% of the registered providers in the combined North Country Mountain Lakes region for the program agency. Upcoming training, I reached out this morning to Fort Drum for Fort Drum EMS Day. I run into Ryan Blador, who helps run it over the weekend, and we're gonna get something scheduled for the May-June timeframe for providers to get out onto Fort Drum and use their simulation lab. It's a really fun day, so. REMAC expiration dates, I don't know what we wanna do with these, Debbie, but I'll let you talk.
So we will be putting this out to fill these positions so that they would go into the June. We'll put out the application and we'll get them back here, and then Sarah and I and Jonathan can go over them and fill those positions before the June meeting. So we'll put out, we have a letter that we put out with how many openings by county. We'll get that done and get that out here in the next week.
Miscellaneous EMS office participation, state quality metrics, the state legislative committee, state systems committee with the review of 0606, which is the CON process, and then the state data and informatics committee, and we are on the NEMSIS 3.5 update education team. State meetings, we attended them in December and February. Well, Ann attended them in December and February, and I will be going in from now on in May, September, and December. The EMS Memorial will be May 23rd in Albany. As soon as I have the flyer, we'll get it sent out to everyone. It's always really nice to see lots of representation from the North Country. And last year, I think we had 4 or 5 agencies come down. Senator Reagan had crews there. It was nice. Other miscellaneous, so the CNY Health Emergency Preparedness. So Ann was on that committee. Now Ann's in charge of the committee with her new position, and I am filling her former position there. We are participating in the Northern New York Child Fatality Review Team, the Central and Western Stroke Coordinators, group planning, the Samaritan Medical Center stroke meetings, Upstate Stroke Quality Group, the Jefferson County Mental, or MIH, that's not mental, sorry.
Yes, it is.
Is it? I don't.
Mobile integrated.
Yeah, mobile integrated health meetings. The program agency contract was submitted, renewed. And then again, if you have any paperwork to be submitted to our office from your agencies or on behalf of your agencies, we just ask that it be sent to paperwork@fdrhpo.org. That way that's a constantly monitored inbox by all of us on staff here. So if you need something done in a timely manner, send it there. Somebody will get to it. Any questions for the program agency? That dog must have a question. What's next? All right, drug shortages. So we had it reported to our office that there was a shortage on glucagon, albuterol, and Versed. With Dr. Delaney and Dr. Bombard's blessing, we worked out a formulary for a substitution for albuterol, going to Zopinex, and also requesting to go to the alternate formularies for Versed that are already in the plan. We haven't gotten official word yet. I did have a phone call with the state last Thursday that made it sound like albuterol was gonna go to Zopinex, but then I got a phone call on Friday that said it wasn't. Again, I don't have anything in writing. Same for switching to the alternate formularies in the policy statements from the state for Versed. We haven't gotten anything in writing saying that they approve us to go to it, but because it's already in the formulary, REMAC can approve it. where Dr. Delaney can approve us to go to it, and we just have to send notification to the state that that's what we're gonna do.
So what are we gonna do for these BLS agencies that can't get albuterol? Those of us that are advanced, we have the dual nubs, which we can use, but BLS people can't do that. So what direction are we gonna provide to agencies so people that are having difficulty breathing get treated?
That was the idea with Zopanex, being able to administer it with ages 1 through adult at 1.25
So what
to 3
I told
ml.
the problem with Zopanex is it isn't in the already approved formulary, so it has to go through a CMAC or SEMSCO meeting because we don't have a state medical director who can just sign off on it. So by them essentially dragging their feet on appointing and going through the process of having a state medical director, we're in this position we are now. Zopanex is the answer.
But I thought Zopanex was, I thought Ann had said that you mentioned it had gone on shortage too.
Expensive, but.
Expensive.
Yeah, that's originally, yeah, was my concern, but from a medical standpoint, it's the only option.
Because it's not listed in the back of whatever it listed in formulary drug.
Yeah.
And that's the hang
Yeah.
Jonathan,
Yes, Mark?
did you talk to Dr. Doyle or Dr. Marshall to get it on the med standards agenda?
No, Bagosi did though.
Are you sure Bagosi did?
I'll follow up tomorrow.
Gotta have 30 days before that meeting in order to
Has to
make
get
it.
on both Lou Marshall's and Don Doyle's agenda, and those are going to be due probably Friday for EDCC.
All right, I'll take care of it tomorrow.
Yeah, that'd be in order to get our.
Yeah.
30 days submissions.
So glucagon, there is a substitution for that we just have to, again, as the REMAC, it's the GVAC pen. It's an auto injector. It's the same dosage and everything. It's just more expensive. I think it's probably $200 more a kit. Yeah, so it's not,
It's already expected.
yeah.
And glucagon's like 250, this is 300 and something.
That's common for chickens.
Yeah.
I mean, I would entertain a motion to do that. I can draft everything up and have Dr. Delaney sign it, and that just goes out as a memo to the region that this is the direction we're going with, and we just notify the state that this is what we're doing.
And I think we should also do this open expanding the state meeting in May so that we don't have to wait till our meeting in June. So that would be all. So we need a doc to.
Yeah, we need a doc to make the motion on that. Dr. Coates,
We lost me.
Dr. Delaney seconds. All in favor?
Aye.
Thank you, Dr. Bevan.
Is that all three of them?
Yep. So we also have a reciprocal agreement, CME agreement with Mountain Lakes. This is just gonna make it easier for our providers that live on that border area of St. Lawrence and Franklin County that are frequently passing back and forth. It's gonna make it so they don't have to dual credential in a region, especially now that we share program agencies. And it will hold them to the higher, I want to make sure I say this right. It will hold them to the higher requirements for the region that they're operating out of. So if they operate in both North Country and Mountain Lakes, they will be held to the standards of North Country. Yeah, I need a motion for that. Dr. Delaney makes the motion. Can I have a second? Dr. Coates. All in favor? Perfect. EMS, transport of blood products. So they put it out that regions could apply for the ability to apply region-wide for ambulances to carry blood products. We don't carry the insurance for that. I think it would be a horrendous liability for all of us, for the region to take on. If an individual agency were to do that, then so be it for the agency, but for the region as a whole to sign off on it, all agencies being able to carry blood products, I just think that's not great. And the wording of the stuff isn't super solid either. So if we all agree with that, or we can discuss it.
Jonathan, two things. One is it's still interfacilities only. There's no provision to allow ground ambulances to carry blood in a 911 setting. And the part of 3003 that says that SEMSCO shall promulgate rules and regulations for blood is finally occurring. And I believe that draft is going to be at the SEMSCO meeting that will streamline the process to become an ATS significantly.
Thanks, Mark. Okay, so the next thing is the REMAC CME sheets and the manual. So I'm going to pull up the sheets first. And Debbie had some suggestions for this, so I'll let you talk, Deb.
So I would like to propose that for the first and second semester, that we add supraglottic airway for the AEMT. And then under the second semester where it says adult IO, that should have AEMT in it as well. But we've taken the innovation away, but I think they should be doing the supraglottic both semesters as an advanced provider. And again, the IO second semester, it says P and CC, it should also say AEMT.
Any questions about that? Can I have a motion to approve the changes? Dr. Coates. Dr. Delaney seconds, all in favor? Thanks, Matt.
Either way.
All right, so the next thing is the REMAC credentialing manual. The first big change is putting FDR-HBO, North Country EMS Program Agency on there versus the EMS Program Agency. Next is just changing it from credentialing to registration and certification. When it's revised, we needed to update our address on it. We also needed to update our website on it. That hasn't been our address in forever.
Phone number also.
Oh, yeah, and we need to update the phone on it. That should be option 2. Scrolling down. Debbie, you I don't have a printed copy of this. Can you? Yeah, I can't see. I don't know which was changed because it's all blue for me.
Okay.
Yep.
So under the program administration, adding certified, we're putting the word first responder in there from basic EMT. North Country EMS region. And adding at the end of it, sentence, agencies must ensure that all providers above the New York State certified first responder level are in good standing within the region. And the reason it's been bumped down to first responder is they're now allowed to do some of the modalities. So if they're doing the modalities, they really should be registered in our region so we know who is out there doing them. And remember, this is no longer credentialing, it's a registration process. The next is the REMAC certification. Again, it's standardized. We're using the New York State EMS collaborative protocols. And the evaluation will consist of an online exam. So we added the word online in there. REMAC certification. it says, instead of credentialed, it now says registered. The next one says the CME manager must send the program agency a copy of new and returning providers, the New York State EMT card. So can we just talk, why do we need to do that when you can pull them right off?
We don't need to do that. They just need to contact our office.
So we need to strike that then. Right, so two can be gone. North Country EMS Program Agency will verify the provider is in the system. The CME manager will receive an automatic notice that they are verified. The person then needs to complete the appropriate protocol exam, and I know we've talked about, we were gonna get those updated as well, so we gotta get the
and they
protocol
have been.
exams updated.
Yep.
And that they need to be completed prior to going online. And by going online, we mean in order for them to do any of those modalities. And each, so number 6, again, we're taking out A, we don't need to provide you the EMT card. That's the only thing there, so that whole 6 can go, all of 6 can go then, so that's the only thing that's there. You have to score 80% or better. If a provider does not achieve a passing grade on the second attempt, they will need some remediation and wait 5 additional business days before they can retest. CME manager will receive automatic notice of providers' test results, and again, the word credentials changed to registered. The thing with number 9, registered instead of credentialed. Maintaining certification. We've added under the EMT that they just have to do their skills once a year, and changed it to AEMT from intermediate. Phonetics, the North Country Regional Manager or their designee, not his designee. Providers must complete at least half of the required hours in the first semester, and at least half of those must be at the ALS for advanced providers. You can do all of them in the first semester, or you can break it up. And Air Medical can use their CME certification for that. Again, Phonetics changing it from his to their. And maximum hours for advanced providers. Maximum of 12 hours may be credentialed for a specific class, and a maximum of 24 hours may be accredited for teaching EMS related training courses. Instructor credit, the CME sheet, there's no book anymore. Skills testing, number 3, changed it to specify AEMT, critical care, and paramedics are required to perform those. And this is something that we really need agencies to work on. People are under the misnomer that they have 15 days from the end of the semester. The semester ends June 30th, that's when they have to be in. You don't have until July 15th. They're due June 30th, that's when you need to have them in. CME sheet for the specific skills. Again, the next one, changing it from credentialed to registered. Reporting system, again, sheet from book. Taking out where it said you send them into the office. Those are kept at the agencies. And at any time, they can be requested to look at somebody's, to see what they've done for skills. And I believe this has recently come up as a result of some CQI issues, so we do occasionally need to see those. The next page, the North Country Office of REMAC will review for accuracy. Again, randomly as determined to look at them, changing credentialed to registered. Pre-approved programs, changed it from EMT, added AEMT, from advanced, original refresher counts, has to be documented. ACLS, this must be documented on the regional CME form, and PALS, the same thing. Next page, any international or nationally accredited medical training institute or nationally recognized EMS conference was added in. REMAC recertification, again, changing it from credential to verification. BLS providers will need to complete defibrillation and adjunct skills annually prior to December 31st. Again, credentialed to registered. And then non-compliance, document all CMEs under the notes section in the online CME system and verify completion. That should be kept on file and made available to the office when requested. And failure to do so could revoke in the services qualification to provide ALS level care. Next page is all formatting with the exception of where it says credentialed, it was changed to registered. And the email address was changed. Again, at the bottom, credential changed to registered. We've deleted being able to suspend people. We need to ensure that they do this stuff. Agencies who bill cannot submit to CMS for reimbursement if utilizing providers who are not registered within the region. If you go on medical leave, upon return, providers need to complete any outstanding CMEs. We've taken out within 1 year. We say, if you've been out on leave, you should demonstrate those skills so that we know that you haven't lost those skills if you were out on a leave of absence. Those are the big things there. So that is the changes.
Can we have a motion to approve the new provider registration manual? Dr. Delaney, can I have a second?
Second.
Dr. Coates, seconds, all in favor? Other new business, I don't have any. Does anybody have anything for the good of the order?
I do. We received a letter in March telling us that Dr. Maynard's appointment to the CMAC ended in December 22. And after talking with him, his work schedule really is not conducive to going down to Albany. And Dr. Coates is willing to entertain becoming the CMAC doctor. I'm just waiting for him to forward me his CV so I can do the cover letter and get that down to Albany so that we can get him appointed. So I'd like to thank Matt for stepping up and doing that and helping us out with that. And hope to, he'll still be appointed until next year when we get Dr. Coates on, and then a year of his term will already be up and we'll start this whole process again. So.
Anything else?
As far as just a kind of question with the, I know why it's changing from credentialing to registration in the region. With that, from my kind of past experiences, has there been some emphasis on regional, from the REMAC to the agency medical directors to take some ownership in the process of reviewing and remediating the providers at the agency level? Because that's kind of where the strength is now.
I actually have a letter that is done to review with Sarah, but Ann felt we should get this updated first so that we weren't in
A weird place, yeah.
And then, so I have that to go over with Sarah so that we can send that out to the agency medical directors and let them know that we need them to take a bigger role in that.
The provider, that's their agency level.
Yeah.
It's gone this way, but it's.
All right, with nothing else, I'd entertain a motion to adjourn. Dr. Maynard? Can I have a second? Dr. Delaney, all in favor? All right, thanks, everybody. Have a good night.
Okay.